Good day, everyone. Today I'm going to share with you about facts in health and diseases. My presentation will explore the role of fats in our diet. So we will try to um, learn about the fat recommendations and their impacts on health. We will also discuss the relationship between fats, obesity, cardiovascular diseases, diabetes, and cancer related. So I will continue. All right. So before we start, I just want to introduce you about fat. Normally, people thought that fat is actually not good for our health, right? So what is actually fat? Fat is actually a type of nutrients and source of energy for the body, and this is found in food and stored in our body. There are healthy fats and also unhealthy fats. Healthy fats include unsaturated fats such as olive oil, nuts, avocado, and fish. Unhealthy fats include saturated fat such as fatty meats, butters, margarine, and trans fat including fried foods or processed snacks. Okay? So fat is actually important for us to provide energy, help us to absorb fat soluble vitamins such as vitamin A, D, E, K. It also protects organs and keeps the body warm. It's very important for our brain function and hormone production. So now I have a guess for you guys. A quick one. Which of the following is healthy fat? So I guess you guys already noted just now. It's actually olive oil. Olive oil is a source of monounsaturated fat, which is a healthy fat. It can help to lower down the bad cholesterol and can help to reduce the risk of heart diseases. And olive oil usually will be used in healthy diet recommended such as Mediterranean diet. And the other options are less healthy such as butter, which is high in saturated fat and raised bad cholesterol. Fried chicken skin, which contain trans fat and saturated fat, especially if there is a deep fry. While margarine, especially the hard type, contains trans fat, depending how it's made. Another question about fats is which type of fat can help reduce bad cholesterol? And the answer is monosaturated fat. It's actually a good fat, healthy fat can lower down the LDL in our blood. It also can help to increase the good cholesterol, which is LHDL. This supports heart health and reduce the risk of heart diseases. Foods that rich in monosaturated fat include olive oil, avocados, nuts, and seeds. And one more question. What kind of fat should we eat less of? I guess you know that. It's saturated and trans fat. So these are considered unhealthy fats. All this will cause raise of LDL, risk of heart diseases, and stroke. An example of the fat is like lamb, beef, pork, high-fat dairy such as the whipped cream, ice cream, whole milk, butter, skin on poultry such as chicken, duck, palm oil, cocoa butters, coconut oil. While trans fat is even more harmful. It raises LDL and lowers HDL. Trans fat include a lot in fried foods, fatty meats, butter, processed snacks, chocolate, cake, margarine, burgers, pastries, and ice cream. All these very delicious, tasty, but not healthy fats. Sometimes they also not putting out trans fat in the recipe, but they will just put partially hydrogenated oils. Just be careful. So we know that in the World Organizations and from our Malaysia's, the National Health Mobility Survey, the latter shows that the trend in overweight and obesity among adults in Malaysia is increasing. In 2023, it's actually even worse. Around 54.4% of Malaysians having obesity and overweight. Now let's see the next one. You must know your fat. All right, 33.3% of adults in Malaysia have high cholesterol. That is about 7.6 million adults. And do you know that increased level of cholesterol often show no symptoms, just like hypertension and diabetes? And 1 in 2 adults with high cholesterol do not know that they have high cholesterol. So from the recent studies says that in Malaysia, the fat intake, according to the MENS 2014, median total fat intake of 29% of TEI among the Malaysians is actually aligned with recommendations. So the NHMS 2015 also shows that 70.7% Malaysians were obese and 30% were overweight. Now even worse, 2023, the research shows that 32.6% of Malaysians were obese and 31.8% were overweight. So the guideline and WHO recommendations has found that total fat intake should be less than 30% of total energy intake to prevent unhealthy weight gain. Right. And also the study also shows that the recommended fat intake for total fat it should be 25 to 35% of total energy intake for adults and children. While saturated fat, it can be limited to less than 10% and less than 7% for those who have metabolic disorder. While trans fat, we try to avoid completely or at least limit to less than 2% of the TAI. While MUFA and PUFA, which we know that is a healthy fat, should encourage as replacement for saturated fat. Now we'll come to talk about our healthy fats. The MUFA and PUFA is very famous. They are generally very good for us to take as our part of our diet. So you can see the resources such as avocado, they contain high omega-9, and this help to improve memory, strengthen immune system. The rest of the sauce like olive, almond, cashew nuts, peanut oil. Where you can see nuts and seeds, it actually contain high omega-6. And these are vegetables, oils, nuts, seeds, meats, eggs. And this will help to reduce menopausal syndrome for ladies, eczema, rheumatic arthritis, diabetic retinopathy symptoms. And for fatty fish, they have also very high omega-3, which contain EPA, DHA, and ALA. And all this is like mackerel, salmon, cod liver oil, walnuts, soybeans, and chia seeds. This research recommends that consume 2 to 3 times a day can help reduce the cardiovascular diseases risk and prevent anxiety and depression, and also Parkinson's diseases. So it's very good for us to consume more of these healthy fats. You can see the other fats content. It can help to remember and increase all these kind of good fats resource in your diet. Come to another research that shows that we should prioritize cooking methods. And during our cooking method, we should understand more about oils that we use every time we cook. For example, the type, the saturated of fat, the smoking point, oxidative stability, flavor, and the type of cooking. You can see some of our cooking oil comparison. They are containing those monosaturated fat and polysaturated fat higher. That means they are good. You can see this canola, olive, almond. They are very good cooking oil that you can choose. Now come to another research. The study shows that about fats and obesity. So as says that the omega-6 should be balanced with omega-3 to prevent obesity. Everything also need to be balanced. You cannot have higher omega-6 but lower omega-3 and the other side too. So higher SFA and lower PUFA linked to obesity means you take more saturated fat but you take lesser healthy fat, PUFA, MUFA. It will cause us to have high obesity and overweight. Well, excessive cholesterol also linked to higher obesity in this. So we must understand and we must take good care of our health since young, and we must practice that so that it can help us to guide our family and friends. And of course, the study also suggests that balancing omega-6 to omega-3, because omega-3 intake is very important and to help this kind of to reduce the risk of non-communicable diseases. What about facts and cardiovascular diseases? So the study actually shows that this a large body of evidence shows this palmitic acid is from palm oil. The fats could increase total cholesterol and LDL-C concentration, and palmitic acid is a well-known risk factor for cardio heart diseases. And a high-fat diet actually significantly increase the blood pressure, especially the systolic blood pressure, and the cholesterol, and also blood glucose level, BMI, all of which it can cause the high risk of cardiovascular diseases. While the Mediterranean diet, which is rich in olive oil, is globally recognized for its health benefits, with increasing evidence suggesting that the oleic acid plays a key role in reducing the incidence and mortality of cardiovascular diseases. So we wanted to know that if we can use proper cooking oil and we choose those healthy and good fats, it actually can help out with our health a lot. So let's come to these fats and diabetes. What about the relevance between them? So the research actually found that this cholesterol is actually directly associated with type 2 diabetes and reduce the pancreatic function in response to glucose and thought which inversely affect the insulin sensitivity. It may also increase the insulin resistance by inducing the accumulations of cholesterol, ether, and triglyceride in our liver. Well, type 2 diabetes also has an inverse association between this PUFA, and it can affect our glucose metabolism. So PUFA is known that it can contain this omega-3 and omega-6 and help to improve this insulin sensitivity and glucose metabolism, which is very good for those diabetic patients. And of course, you can know that incorporating sources like the fatty fish and flaxseed nuts can be very beneficial for diabetic patients. Let's come to see the facts and cancer. What are the relevance? So research also actually found that elevated total saturated fatty acid in our diet will cause the bloodstream associated with very high various cancers, such as breast cancer, prostate cancer, and colorectal cancer. So this kind of fat is very linked to the cancer risk. Fatty acids is very contributed to cancer cell growth, metastasis, and immune system suppression by providing the energy and acting as signaling molecules. So excess dietary saturated fat can also promote obesity, which will increase the cancer risk by reducing the anti-tumor activity of immune cells. Well, PUFA, this can actually help to contribute to cancer cell death, which demonstrate a very anti-cancer efficacy. But a high intake of total fats, total cholesterol, it will actually increase the colorectal cancer risk. You can see the myristic acid, pantanoic acid, and palmitoleic acid. All this is very bad for our health and increase the colorectal cancer. While the PUFA, it will help with the shows the effect helping with the protective effect against to colorectal cancer. So let's come to the mental health relevant with facts. What about the facts? Will it affect our mental health? It will. You can see here, trans fat. If you eat a lot of trans fat, those very delicious but unhealthy fats, it will associated with increased inflammatory processes, worsen the mental health. So it will cause a lot of depressive symptoms. Sometimes after we eat a lot of this kind of fried food, processed meats, and those snacks, unhealthy snacks, we will feel a bit guilty, and then we will feel depressed after all. And PUFA and MUFA actually can help with link to the lower odds of depressive symptoms. So can try to get your depression patients to eat more PUFA and MUFA's kind of source of fats. And fats and total mortality is for some of the research, it found that the saturated fat and also trans fats, it will link to higher mortality rates, especially the red and processed meat. They have even higher mortality rate. Well, this because of the link between these cancers, diabetes, cardiovascular diseases. That's why the bad fats, it will cause higher mortality rate. While good fat, the research also shows that it associated with lower all-cause mortality. And always remember, plant-based fats is much better than animal-based fats. So excessive fat mass also will cause hypertension, diabetes, cardiovascular diseases, cancers, and all kinds of chronic diseases. So be aware of our choices for fats. So the key takeaway for today about fats in health and diseases is that the type, the quality is matter. We consider quantity within the recommendations. We also must consider the type of the fat. Focus on specific unsaturated fatty acid. But balance is always the key. Omega-3, omega-6, omega-9, all these ratios are crucial for our health and well-being. Well, last but not least, plant-based oils always will better compared to others oil because of the MUFA and PUFA. Compared with other saturated fat, we try to go for the better one. So the plant-based oil link to lower mortality rate. So this is my recipe. It's a recipe that promote healthy fats. We use different kind of nuts, seeds, and some of the cranberries, soft nuts, limes, all these very natural sources, ingredients to make this very delicious super sweet energy balls recipe. I have recorded down, and feel free to take a look and try it at home to serve at your house. I will not go through this. Later you can have this video. This is all my references. That's all for my presentation. You can have this code to scan so that you can test your knowledge after this education teaching. Thank you, everyone.